remember, you're happy. You're so happy. It's like the
Hi,
happiest
my
moment.
name is Kimberly Hull. I am a third semester nursing student here at Montgomery College. I have been attending Montgomery College since the 2013-2014 year, and I took a philosophy course in 2014 because I needed one more humanities class to fill my requirements if I was going to move on to Stevenson University. The intro to philosophy was that fit the criteria. So I took the intro to philosophy class and was informed of the ethics bowl, the philosophy club, and then the ethics bowl. So I decided to pursue it because I really enjoyed my philosophy class. I liked that we talked about ancient concepts and applied them to real life and what was going on currently in the country, in the area, and globally. I really liked the application portion of taking something I was learning in class and applying it to what was happening in real time. So I decided to go to the philosophy club meeting and was introduced to the concept of ethics bowl with some of the cases that we were going to be talking about, and was really interested. The debate discussion portion of the ethics part really helped me apply some sort of level of critical thinking to presentations and how to discuss things with less emotion, so that it could be a more effective discussion based on facts and reasoning as opposed to emotion. In our weekly meetings and training sessions, we discussed the cases and we fleshed out four options. What's the problem in this case? What's a solution? What do we think about? What do we think should be done? What position are we going to take? What the flip side of that is, and any suggestions for changing the situation. So we discussed that in a group format, and each went around, and it was sort of an open discussion. So we discussed we each had contributions to that discussion. And what was challenging and rewarding about that is that it made me have to think on my feet a lot and consider what I was saying was relevant and spoken from an unemotional standpoint. Emotion is good to throw into arguments when it's used constructively and when it doesn't detract from the group as a whole. And it helped me to learn how to harness that emotion and make it more functional in that type of a discussion, which in turn makes it better for me professionally to carry on, in the nursing profession especially, to carry what I hold ethically and morally and turn it into something good that I'm using to take care of my patients and be the best advocate for patients. On the day of the bowl itself, I got up ridiculously early and was extremely nervous and sort of ran through all the scenarios again in my head and read through them all again and tried to think if there was anything that I hadn't thought of yet. And when we went into the first heat, the first round. It was very informal because it was a small room, but we were at tables across from each other, so it wasn't like we were on a big stage where everybody was watching us and judging us. So I felt a little bit more at ease, and I had the comfort of the people that I had been discussing these things with, so the familiarity of it. And once we got started, it sort of fell into a nice rhythm that we had practiced, and we were able to sort of feed off of each other and present our arguments in what I thought was compelling, and really work together as a team to present what we had worked on. Academically, it helps me, in nursing especially, I'm learning how to move into the next levels of learning. So I'm learning how to not only apply what I've learned, but to use it in an analytical sense and be able to take the information in front of me and determine what I'm supposed to do. And it's different from a classroom because now it's dealing with patient care and taking patients that are in medical either crisis or, making a decision, a determination on what is going to happen next. And so academically, well, I guess that's more intellectual. It's helped me develop that part of my learning style and help me advance closer to my goal above just rote learning and repetition and really applying things that I've learned. So academically, it complemented my nursing courses very well. I was able to see how bioethics were relevant in what I was learning in school and really made me think a little deeper into the issues that we were discussing when it came to patient care, when it came to respecting patients' decisions and religious and cultural aspects. It really made me think more deeply about those types of situations in a way that I don't know that I would have considered prior to graduating from the class, and maybe not even until I was in front of, in that situation in a nursing capacity. And psychologically, it has helped me learn how to be a more persuasive and reasonable person in a discussion, as opposed to just saying whatever comes to my mind. It helps me form rational, chronological, and compelling thoughts. And now, how does that fit in the way I understand my time at Montgomery College is, I'm an adult student, so I didn't get that typical living on campus and being involved in clubs and what I think people think of when they think of college. And what this has allowed me to do is immerse myself in the college experience even though I'm not a traditional student. And it's also allowed me to take that into a holistic view and use that for both academic purposes, my current job, and I have definitely, everything I hear through the television and the radio and news, I consider from an ethical and philosophical standpoint now, which is a blessing and a curse. But it makes me consider current events more deeply, and it makes me consider how I'm going to use this in the future with my career and how that impacts patient care and where I'm going to continue my education from here on out. That's it for me.